Hi, this is Sandra Dinwiddie for NUR612 Health Assessment, and this is my patient. I'm going to be doing my head-to-toe assessment. Prior to getting started, I asked him to empty his bladder, put on comfortable clothing. I collected a full set of vitals, including height and weight. He is alert and oriented ×4. I completed the Snellen chart for distance vision and the Rosenberg chart for near vision. So we're going to get started, and I'm inspecting his head. There are no lesions. There don't appear to, the hair distribution appears even. Palpating his head, it feels normal cephalic. Touching his sinuses, his frontal and maxillary sinuses. Any pain?
No.
Okay. All right. So, can you please puff out your cheeks? Can you stick out your tongue? Can you pull it back in? Can you smile? Frown? All right. Close your eyes really tight. Okay, good. Open them. All right, so that's testing cranial nerve 5. Now I'm going to use a Q-tip to test sensation on cranial nerves 5, 7, and 12. That is the trigeminal, the facial, and hypoglossal nerves. Close your eyes, please. Tell me if you feel sharp or soft.
Soft. Sharp. 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 Soft.
Okay, thank you. All right, so now moving on to his eyes. His eyebrows grow to the outer canvas. His eyelashes move up, looking at the lacrimal glands. There's no excessive tearness or dryness. Can you look up? Looking at both the conjunctiva, it's pink without any nodules. The sclera appears white. There's no jaundice. Now I'm going to palpate your eyes. Close your eyes for me. Any pain?
No.
Okay. No nodules felt. Using my pen light, okay, I'm going to determine if his pupils constrict. Okay. Also, I'm going to test for accommodation. If you can look across the room, focused on the line. All right, I'm going to come in with my finger. Okay, perfect. So I've got accommodation. His eyes are both direct and consensual. So now I'm going to do the cover on cover test. Okay, perfect. I don't notice any extra eye movement, no strabismus noted. Okay, now for the cardinal field of gaze, I'm going to have you follow my pen light with your eyes not moving your head. Okay, perfect. All right, so no nystagmus, the eyes converge as I move toward them with the pen light. So I've just tested cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducis. Now onto his ears. The ears align with his eyes just fine. I'm going to palpate for any tenderness, any pain or tenderness as I touch them. Okay, I'm going to give a tug on the auricles. Any pain when I do that?
No.
Okay, negative tug test. So now I'm going to move on and do some other tests of the ears. So I'm going to have you cover one of your ears, please. And what I whisper, I need for you to say.
Okay.
See?
ABC. 1, 2, 3.
Okay, so the whisper test is just fine. So I'm going to test now doing a Weber and a Rhine test using a tuning fork. So can you tell me if you hear the vibration and sound on both ears?
Yes.
Okay, so Weber test is positive. He hears it equally on both sides. Okay, now with the Rhine test, I'm going to see if air conduction is twice as long as bone conduction. I'll be counting to do that. So tell me when you no longer hear it at your ear.
Okay. Okay.
Okay, it's twice as long on the right.
Okay. Okay.
Okay, all right, so it's twice as long on both the right and the left. Okay, so now I'm going to be moving on using my otoscope, and I'm going to look at the external ear and evaluate for tympanic membrane as well. All right. So looking in his ear, I was able to see that there was no excessive secremen in either one of the canals. In both of his ears, the tympanic membrane appeared pearly gray with good cones of light. There are no landmarks or the landmarks are visible. Excuse me. There is no bulging on either side. Okay, so moving now onto his nose. All right. I'm gonna have you do the cover on cover test. So can you hold one side of your nose? Breathe in. Okay. Other side. I don't have the tools to test the cranial nerve 1, but have you ever had any trouble with any smelling or anything?
No.
Okay, so we're going to go with cranial 1. Cranial nerve 1 is intact, so olfactory nerve. Okay, so now I'm going to use the otoscope again, looking inside of his nose. Okay, so using the otoscope, I was able to determine the turbinates are not enlarged. The nasal mucosa is pink without any swelling. There don't appear to be any polyps or foreign bodies in his nose. Okay, and the nasal septum appears slightly deviated. All right, so now onto the mouth and the pharynx. Okay, so I'm gonna do these different things and then I'll talk to them. Okay, so go ahead and open your mouth, please. Say ah. Okay, and turn your tongue. Yeah, one side, other side. Lift your tongue to the roof of your mouth. Okay, thank you. All right, so I was able to inspect the oral mucosa. It's both pink and moist. Looking in his teeth and his gums, they all appeared intact. It looks as though there are 32 teeth or so. The tongue was mobile with no lesions and well papillated. The posterior pharynx, from what I could see, was intact. The hard and soft palate were also intact. Okay, so when he said ah, I was able to see the uvula raised midline. The tonsils did not appear visible. Okay, so I'm going to do one last test and test the gag reflex. Can you open up? Sorry about that. So clearly gag reflex is intact. So we have cranial nerve 9, 10, and 12 intact. So it's the glossopharyngeal, vagus, and hypoglossal nerves. So now onto his neck. I'm going to look first, of course. So it looks as though trachea is midline. Doesn't appear as though there's any extra pulsations, no JVD that's obvious. Can you, I'm going to have you move your head from side to side against my hand. Okay. Okay. Can you raise your shoulders? Okay, good. All right. So that was just a test of cranial nerve 11, the spinal accessory nerves. Okay. So I'm going to have you do some other range of motion exercises. Can you put your, can you look up? Okay. Put your chin down to your chest. Look side to side. Okay. Try and put your ear to your shoulder. Okay. All right. Now I'm going to palpate his thyroid and have him swallow and feel to see if his trachea is midline, and then palpate the carotid arteries. Okay. Swallow for me. Okay. Carotid artery. Okay. After palpating the carotid arteries one at a time, both felt as +2 and strong and regular in rate. Okay. So now I'm going to move on to the lymph nodes, and I'm going to palpate through. I'll talk to them. Okay. So preocular, posterior, ocular, occipital, tonsillar, submandible, submental, anterior superficial clavicular nodes, posterior superficial clavicular nodes, deep cervical chain, and the supraclavicular nodes. Okay, so now I'm going to listen to the carotid arteries and also his thyroid to see if I hear any breathe. No bruise on auscultation. So now let me see your upper extremities. I'm going to look at his fingers. No clubbing. Get good cap refill. Cap refill less than 3 seconds. Skin turgor. Good skin turgor. No tenting. I'm going to palpate the radial and radial pulses. They're all 2+ and strong. Okay, so now I'm going to have you scoot up in the chair and just take off your shirt, please. Scoot up so I can see your back. Just go to the end of the chair. Thank you. Okay. So the back appears, there's no lesions, no scars, no cyanosis. Okay, I'm going to test for costovertebral tenderness of his kidney. Any pain?
No.
Any pain?
No.
Okay, good. Now I'm going to check for thoracic expansion of his back. Okay, go ahead and take a deep breath. Okay. The excursion appears equal. Now I'm going to test for tactile firmness. As you feel my hands, can you please say 99?
99. 99. 99.
Good. Okay. So it feels equal bilaterally as I touch. Okay. So now I'm going to percuss the intercostal spaces, looking for resonance or listening for resonance, and then I'll move on to diaphragmatic excursion. There's dullness over the bone and resonance over the intercostal space. Okay, so again, onto diaphragmatic excursion. I'm going to grab my tape measure and my marker. Okay, so please take a deep breath and hold it. So I'm marking where I'm getting dullness. Let go. Okay, so I'm going to percuss until I no longer hear resonance and mark it with a pen. I just did that. And you now onto the other side. Take a deep breath and hold it. Okay. Let it out. Okay. And then so I'm going to have you blow out, take a deep breath, and then blow out, and I'm going to percuss to see where the diaphragm lands. Okay, keep holding. One more time. Okay. All right, so now I'm going to measure. And on both sides, it appears as though there's only about 3 centimeters of difference between the 2 points. So now that is testing the diaphragmatic excursion with no asymmetry as noted. Okay, so now I'm going to listen to or auscultate the posterior breath sounds. So deep breath. Deep breath. Okay. All right. So I heard testicular sounds over his posterior chest. See if you could sit back in the chair. Okay, good. Now I'm going to move on to his anterior chest and his heart. So I'm going to do a few different things, and then I'm going to talk to them, and then I'm going to do them. So the chest appears free of lesions on inspection. There don't appear to be any heaves. There doesn't appear to be any retraction. No cyanosis noted. Chest wall appears symmetrical. Okay, so now I'm going to check for diaphragmatic excursion. And test for his chest wall excursion to be equal. Then I'm going to palpate and then palpate the chest, percuss the chest, and then listen to the chest. Okay, before I move on to the heart. Okay. Take a deep breath. Okay, good. All right. So I got resonance across the chest. So on percussion, any tenderness? Okay, wonderful. All right, so now I'm going to listen to his chest and hear for breath sounds. Then I'm going to move on to his heart, so it's challenging just not to go straight to his heart. So, but again, I'm not noticing any JVD, no pulsations. But the first space I'm going to listen to is his aortic area, which is on the right side of his chest. At the second intercostal space, then move over pulmonic area, then onto Erb's point. At the third intercostal space on the left, the tricuspid, at the fourth intercostal space near the sternum, and then finally onto the mitral area. So I'll be doing that kind of in one motion here. So listening first for his lungs, take a deep breath. Okay, breathe normally. Okay. So again, got vestibular sounds from listening to his lungs, but then I can hear S1 and S2 when I listen to his heart with no extra heart sounds, no gallops or murmurs noted. Okay, so moving on to the abdomen. Okay, so I'm going to have him move from this chair and lie down. Had a change in furniture, but abdomen appears flat with, well, actually somewhat rounded, but without any noted protrusions or pulsations. Can you just lift your head slightly? So, okay, good, perfect. You can put your head back. No umbilical hernias noted. The skin appears intact, okay, and the umbilicus is midline. So now I'm going to listen to his stomach, to auscultate his stomach. Listening for vowel sounds, starting in the right lower quadrant. Left upper quadrant. Left lower quadrant. Okay. I could hear vowel sounds with no hyper or hypoactive vowel sounds noted. No turbulent blood flow either. So now I'm going to listen to various pulses within the area. Okay. So listen to the abdominal aortic, the renal, iliac, and femoral, and there were no abdominal bruits that were noted. Okay, so now I'm going to percuss throughout the abdomen and then transition into palpation. So I'll do light palpation first and then deep palpation. Okay, so I heard definitely more tympany throughout his stomach. Okay, so now I'm going to move on to, actually I'm going to percuss for the liver. So starting at the mid-clavicular line, getting resonance onto dullness, okay, and then percuss up from the abdomen. Percussing for his liver, and I heard dullness across the liver span. Now I'm going to percuss for the spleen. I'm getting splenionic dullness as well. So now I'm going to palpate the abdomen. Tell me if you have any pain or tenderness on light palpation. Okay. Now I'm going to palpate deeper for the liver, the spleen, and the kidneys. Okay. So for the liver, I'm going to be reaching under the right costal margin. So you're going to take a deep breath when I do that. Okay. And I'm not finding the liver to be palpable. So now I'm going to go for the spleen and over the left costal margin to see if I feel for that. And the spleen is not palpable either. So finally onto the kidneys, where I'm going to touch under the flank area, touching for the right kidney first. And neither the kidneys nor the spleen kidney, neither left or right kidney are palpable. Okay. So finally I'm going to go palpating for the abdominal aorta. I'm not feeling that either. So so I'm not feeling which direction necessarily the blood is going. So now moving on to the pulses. Okay. So I'm going to palpate the femoral pulses. Challenging to do. He's still got his shorts on. Okay. So now just on to the lower legs. So I'm going to palpate for dorsal medial pulses. Posterior tibial pulses. Popliteal pulses. They're all +2. Okay. Now I'm going to have him sit back up. Okay. Okay. So I'm going to have him sit back in the chair to test for strength. It's challenging to get out of that. Sorry about that. Okay. So can you grab my fingers? Squeeze. Good. Okay. Resist against my feet or your hands. Okay. And come back. Push down. Good. Okay. So strength appears intact at both the upper. Oh, here. Push down. Good. Up. Good. So strength appears intact at 5 out of 5 on both the upper and the lower extremities that were tested. Again, I tested the dorsal, posterior tibial, and popliteal pulses. They were all +2 bilaterally. So now I'm going to palpate the knee joints for any pain. Pain as I touch? Okay, good. All right. So now I'm going to test for sensation in the lower extremities. So can you close your eyes and tell me if you feel smooth or sharp?
Smooth, sharp, smooth, sharp, 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 smooth.
Okay. So we've got sensation in all of the extremities. Now on to the deep tendon reflexes. So just bend your elbow. Okay. Okay. Then look away. Close your eyes. Close your eyes. So I was able to elicit at the elbows and the deep tendon reflex. So I got a biflex, the bicep and reflex intact, okay, and the radial reflex as well. So since he's sitting, I'm going to hold and dangle his foot, see if I can elicit the popliteal reflex. Yep. Okay, got equal popliteal reflexes as well. So from that, I'm going to have him stand. Okay, can you turn sideways? Okay, so can you bend to your right, bend to your left? Can you lean back? Good. Okay. Can you bend forward toward your, okay. Stand up. Okay. So I'm noticing that the range of motion is intact for the upper body, and he's got lateral curvature of both his cervical spine and his lumbar spine. No scoliosis noted. That then completes my head to toe physical examination. Hopefully this one goes through.